Hello and welcome to our show, On the Edge of Mental Health. I'm Nina Perry and I'm here with David Mineta, President and CEO of a nonprofit organization called Momentum for Health. David, welcome. Thank you for being here.
Thank you, Nina. Thanks for having me. This is really exciting. It's great to be here.
Okay. Well, tell us about Momentum for Health to start.
Well, again, first, thank you for the opportunity to talk about behavioral health. Momentum for Health is a community-based nonprofit who provides behavioral health services. And for us, that means both mental health and substance use disorder services. Okay. And we provide those services across a range of both outpatient, residential, and community-based, the whole continuum of community-based services. Every year we see a little over 4,000 people in Santa Clara County, and this is folks who have both public insurance as well as their own commercial employer-based insurance.
Okay, all right. How did you get involved with Momentum for Health specifically, and in general, what drew you to work in the mental health and behavioral health fields?
Well, again, when we talk about kind of mental health and behavioral health issues, a lot of it is really personal. It's so personal. And I think for me, wanting to become a social worker and work with kids, it actually came because I saw my brother struggling when he was in high school. And I thought, man, I wish somebody was there to help him. And I thought, hey, I could do that. So I became a social worker and haven't looked back since. So going from waiting tables, mobile disc jockey, not knowing what to do, and then finding a career, finding a passion and a mission around my service. And so I've been a social worker for 30 plus years. Again, a lot of our own family history has been connected with behavioral health issues, cousins, and then our own family. So it's really very personal, and it continues to drive me to this day. Getting to Momentum, I did 5 years in the Obama administration with the White House Drug Policy Office. I was in charge of coordinating the federal government's efforts to reduce the demand for drugs. And this was at the beginning of the sharp increase in the opioid epidemic. And then after those 5 years, we were able to come back to California and work at Momentum for Health. And I've been there for now 8 years. Going on 9 this coming year.
Okay. So tell me about the mental health challenges and behavioral health challenges that you see most often today.
Well, really it's kind of the whole gamut. And since the pandemic, we sort of in our field, we think of that the second pandemic has been behavioral health. And so coming out of the COVID pandemic, we have now, increasing numbers. The nationwide data is overwhelming that we have a behavioral health pandemic now. So what we see, some of the trends actually nationally are the same. CDC just reported 3 days ago that our suicide rate in the country now is at its greatest point since 1941. And so in this news around more suicides, we have some good news. Is that the number of child and youth suicides has gone down.
Okay.
So again, whatever we're doing there, we got to keep doing, double down, do more. Again, some of the issues that are coming out are, people who are reporting more anxiety, more depression. We have, on the substance use disorder side, we unfortunately have more overdose deaths, In fact, that's doubled since 2018 nationally and also in California, which we are beginning to see all around the Bay Area and also around the South Bay in Santa Clara County now. So fentanyl that we hear so much about nationally, we are seeing fentanyl as well.
Okay. Okay. So with this increase, with the second pandemic, this behavioral health pandemic, is there an increase in resources that are available to people, in schools and at their companies?
Yep. Yeah. So, again, this is why I so appreciate being able to come and talk about this right now. And last year, our Santa Clara County Board of Supervisors, led by President Ellenberg and Supervisor Lee, made a declaration of a public health emergency in behavioral health. And so I have to say, after 5 years in the federal government, and then now working with our local officials in the county, on a county, state, and federal level, I don't know if I've ever seen this much discussion around behavioral health. Mm-hmm. Wow. Yeah. So, I think the conditions sort of mandate that, and I think all levels of government are stepping up to meet that demand. Okay. And so we're fortunate, I think, that we have the attention of the president, the governor, the state legislature, our county board of supervisors, the county administration, and so there's just a lot people are trying to do to meet this demand.
Okay. And with all this activity, has that done anything to reduce whatever stigma might have been associated or might be associated with mental health issues or behavioral health issues?
Yeah. I think yes and no. And we get to see this in really, I think, in the discussion of and how we treat folks, celebrities. Mm-hmm. Recently, Matthew Perry, I think, and who was in recovery, and then had a relapse, restarted his recovery, and then unfortunately passed recently. All that discussion around his recovery and how he wanted to be remembered at all, right? So that I find to be very helpful. I mean, that's good stuff to tell that recovery story on a national basis. I had the good fortune of working with him a bit during the Obama years, and he just wanted to tell people that there are folks in recovery all around us. And that there are good stories all around, and to have hope. Mm-hmm. So I think when not just him, but I think we've done a lot to destigmatize coming in for services and raising your hand. And I'm hopeful that across the age ranges that we can again lessen that burden for folks who are feeling that something's off. They're got anxiety, they're depressed, they're too sad. Mm-hmm. May even be, hearing voices and seeing things. Mm-hmm. People come in for treatment all the time and get help, and they're doing much better, right? And I think that's the tale we have to tell. That is absolutely the tale we have to tell. And I love being able to talk about it now. Mm-hmm. Mm-hmm. So
how does someone tell if they are having a problem that they need help with? I mean, how do they make the determination, like, I can't manage this on my own? Mm-hmm. I mean, is there an assessment or some sort of test that they can do at home?
Yeah, this is something that, it's sort of I think the beginning point for most people, right? Mm-hmm. If they feel like something, and this is for physical conditions as well, right? Mm-hmm. You feel like something's off, something's not right. Either it's a pain you have, or it's it could be, again, something not working quite right. Something's off, right? The whole point of us now being able to talk about how we feel and how, our sort of mental well-being is about being able to gauge that, is to be able to take an inventory and just go, I don't feel, I've been feeling sad. And now I've been feeling sad for longer, for more days than not.
Okay.
And it's affecting now how I go about my daily life, right? It's those kinds of things. And when you can kind of piece that together, and it gets to the point where I think I need to talk to somebody, that's that point where you can talk to other people in your family, you can talk to a medical professional, you can talk to clergy, you can talk to someone trusted. And oftentimes that will then get you into maybe to see a counselor, a therapist, someone who has professional experience and training to be able to work in, and I would say again, in behavioral health. So that's mental health and substance use disorder. So some folks, again, if on the addiction side, it may be where, I think I'm drinking a little more than I normally do, and now I'm starting to have some things that are, consequences of that extra use, and or now I'm trying other types of substances. I'm a little worried about where this kind of goes, or I'm already starting to experience those kind of consequences. Again, that then connects to I need maybe some help, I need to talk to somebody, and the sooner the better.
Okay.
So, again, that's why trying to take down the stigma, usually that prevents people from getting help early. They wait till it's gotten pretty bad.
Okay. So what is the first step in finding a counselor? And how do you know what to look for? And how do you know if someone is qualified to help you with the problem that you're navigating?
Well, first thing is, unfortunately in sort of our society, it really is sort of what type of insurance you have. So folks who are on public insurance, Medicare, Medicaid, Medicare, then there are certain numbers to call to then get connected to behavioral health services. If you have commercial insurance, employer-sponsored insurance, then again it's talking to your primary care physician and or going to the carrier themselves. The issue, I think, is sometimes it feels like you have to advocate for yourself differently than the physical health system.
Okay.
Sometimes people have to advocate for themselves on the physical health system as well. But generally on the behavioral health system, I think that's where people really feel, and the numbers are there. Folks who meet medical necessity for a behavioral health condition usually get far less treatment than physical health conditions. And it's that gap, that disparity is something that, I think has been the goal for many of us across our years in the profession. Let's close that gap.
Okay.
But again, I think it is talking to, again, depending on your insurance, is then connecting with the behavioral health number or some kind of referral center and or provider.
Okay. And how do you know if a counselor that you've been matched with is a good fit for you?
I mean, like most other things, sort of healthcare services, it's right that rapport you feel with them, how they treat you, sort of what kind of experience they have, and really that interaction, whether it is in person, some of it now is more virtual, right?
Right.
So in whatever kind of medium it is, it is that interaction you have with that specialist. And where I would say that people really need to kind of think about it is like, it really matters to me it's someone of the same gender, It
Okay.
really matters to me if someone of my cultural sort of background, whatever that could be,
Right.
and or language capability, those all really matter in that therapeutic relationship.
Okay.
And you know, when I've been in therapy and in counseling, that has really mattered to me.
Okay.
Someone that understands sort of my age range as I get older, those all, I mean, really, I think people need to sort of consider that. Now, I realize when folks are in need of help, sometimes it's sort of you kind of get who you get,
Right.
and usually the urgency of the need usually may outweigh maybe some of those considerations. But again, ultimately, it comes back to that rapport you have and trust you have with the person.
Okay. Okay. Is long-term therapy or counseling, can that be, something that we do, or are there sort of situations where it's more short-term, like, someone is going through something
Right.
situational and needs help for a little while and then has the
Right.
tools to move on?
Yeah, absolutely. I mean, I think both are true.
Okay.
And oftentimes, and I remember this, as a student at Cal, and needing some kind of, stressed out around finals. I just need help right now, right? I need someone to talk to right now, de-stress a bit. So in those cases, I think some of that short term really kind of works, right? If it is a diagnosed disorder, if it's something that is longer term, and this is going to be something that will sort of condition that'll be with this person sort of for the rest of their lives. Not that they can't do better with through the counseling or through therapy. It's just going to be with them. They're going to have that, like other health conditions. It just may be in remission. It's going to be they're in recovery. That's where that long-term relationship with a counselor, therapist, with some level of service really is helpful.
Okay.
And the other thing is I've seen people, in our agency, we'll see folks who need to step up for a little while to a higher level of care. They feel better. They go through some period, they feel better, and then they step back down.
Okay.
So that's the other thing that it feels to me is also kind of a little natural in the system. Is people sometimes need to step up, they step down, they step up, they step down, and they should not feel there's sort of no wrong door, and they shouldn't feel ashamed or any. It's the condition.
Right. Right. Now, with these conditions that people are living with here in this country, in this county, do you think that those are more prevalent than they used to be, or are they just getting diagnosed more and there's more recognition around that?
Yeah, I think sort of all of the above, if we could. And, again, our understanding of certain conditions, as we do more research, we get a better idea, a better handle on this. And I'd say, disorders on the autism spectrum sort of are, a little bit of our benchmark on this. As we get to understand spectrum disorders more, then we can we see like, hey, this was probably on the spectrum. We didn't know what it was before.
Right.
Now we have a better idea.
Right.
I think that is now for some disorders we have a lot of information on. So again, it's sort of both and, I think. And the issue again is more research, more brain research, more understanding of how social determinants, how our conditions of living affect these behavioral health conditions.
Right.
Or in some ways can even be causal in the behavioral health condition. So I just feel like we're at such an important moment right now,
Right.
Both locally and just, societally across the country around behavioral health.
Okay.
This is our moment right now.
Okay. All right. Well, speaking of social determinants, I was wondering about other countries and the mental health issues and behavioral health issues in those countries, and where there are different social determinants. Are there different scenarios? Is there a different prevalence? And
Yeah.
if these kinds of challenges are rarer in other countries, like, can we learn anything from them?
It's interesting. If in preparation for tonight, I have to be honest with you. I don't deal now too much internationally. It's like
Right.
I barely deal in other counties. I get out of Santa Clara County. That said, I was just doing what we all do. I just Googled sort of like, mental health data, United States versus international, and what pulled up was very interesting. And I think this is our, again, when we look our national data, I wonder how that stacks up to other countries. One thing that was very clear is the United States actually, for mental health disorders, for wealthy countries, the United States is clearly on the end of like high prevalence, like very high prevalence. The suicide rate right now over the last several years has been going up, and that also puts us in a new category of other countries that seems to be going down, and the United States is going up. So, as a behavioral health professional, obviously that's very concerning at all in sort of the scheme of the world. We work on this a lot locally, nationally. To see it in context of other countries, and knowing our resources we have available and sort of the absolute wealth we have in the country, it just feels like this is our time to really do better on this.
And are there differences in someone's lifespan? Like, are we seeing a lot of anxiety and depression in younger folk, like teenagers, or the boomers, or is it kind of across the board?
Yeah, the research that I was looking at recently, number one is that it appears that across the lifespan, in general, that we have a lot of areas of concern around mental health and substance use disorders. One of the data points in the CDC report on suicides that came out this last week was that overall, again, our suicide rates have gone up. Again, the kids and youth have gone down. But what's driving it is the older adults, is increasing rates for older adults. And so, being in the boomer, at the tail end of the boomer age range, that is a huge concern. When I was in the federal government, we talked a lot about the silver tsunami that was on its way. And that's where we're seeing the biggest increase in that suicide rate. So we're going to have to pay more attention, I think, to kind of gerontology, behavioral health work, and make it specific to the boomers, I think. But, I mean, to your point, in specific groups, LGBTQ plus communities have really had difficulty through the pandemic and coming out of the pandemic around behavioral health issues. African Americans, it appears, again, having more issues around mental health issues, particularly and also around suicide. So there are particular groups, and I think that warrant a lot of concern and more attention. And again, I have to say that when these are groups that are being affected, I think, by issues around hate and and anti sort of diversity and equity issues. So all the issues we had around health equity before the pandemic only widened during the pandemic, and now we're coming out and we're seeing those groups having more problems.
Right, right.
So, it seems logical that those communities would be having issues. Again, I think more focus on them.
Right.
And overall, just being able to reduce the amount of hate overall.
Yeah. Yeah. Well, David, we have a couple minutes left. So where can our viewers go online or make a phone call to learn about more resources available to them?
Well, again, thank you for this time to be able to talk about this. And, as someone who, again, family in, receiving services like this, having been in therapy myself at some point in my life, this is so important to get this information out. So, if you are on public insurance, health insurance, in Santa Clara County, if you want to access behavioral health services, call this number. It's 1-800-704-0900. And that is a 24/7 call line to be able to access services, multiple languages. And also in Santa Clara County, we have the 988 number. It's a national number to call about information about behavioral health services. And then finally, though, if you have your own commercial health insurance, call your own provider, your primary care physician. Tell them, explain, how you're feeling. Maybe you think you need some counseling, and or call the insurance carrier directly.
Okay.
Don't take no for an answer if you really feel like you have access to those services.
Okay, great. Thank you, David Mineta from Momentum for Health. Thank you for joining us for On the Edge of Mental Health. Thank you for watching.
Thank you. Thanks, Tina. That was great. Thank you.